Welcome all to yet another Open Talk. So today's discussion is a very important pertinent subject called clinical trial in the field of medicine. So I'll be deviating this topic to clinical trial in oncology per se, but it's applicable to all field of medicine. So what you have to understand is people fear this word trial. So they think that you're doing some experiment on them, you're trying some new modality on them. So all that are not correct. You want to understand that any of the medicines, if you get approved, the most common example I tell is that you have a fever. Everybody jump and take the paracetamol. They take Dolo 650, Calpol 650, they just eat that. So how has this paracetamol been proven in fever? That is by a clinical trial. So none of the medicines are approved in medical practice without clinical trials. So what are those clinical trials? Clinical trial are certain researches which are being done on patients and compared with a healthy volunteer probably, or compared with two arms of patients, and then they approve the medicine for the treatment. So there are different stages in a clinical trial. There is something called preclinical or something called phase 0 trial. Then there are phase 1, phase 2, phase 3 and phase 4 trials. So phase 1 is basically you understand the side effect of that medicine and what dose is expected. Phase 2 you do it in some patients, and phase 3 you do it in a large group of patients. So what you have to understand is by this only any of the medicine gets approved. So clinical trial is the best method to prove the efficacy of the treatment. So without clinical trial, if you approve a medicine, that is not correct is what I feel. So you don't have to worry about clinical trial. So if your friend, family member, anybody is getting an opinion to enroll in a clinical trial, so you get a paper about the inclusion criteria, exclusion criteria, what all are the things you have to fulfill to get into a clinical trial. And you can read that completely. Whatever doubt you have to clear with your doctor. If you want, you can have a second opinion with another doctor, whether that is a relevant clinical trial. And if all the opinions are safe, then I think so you should enroll in a clinical trial. In US, any of the patient who walk into the tertiary or apex cancer institute automatically goes to a clinical trial. Because that is how the change has happened in the field of medicine or field of oncology per se. Oncology is one disease where a lot of clinical trials are happening. Last year, US FDA had around 900 odd clinical trials which was happening. More than 1,200 or 1,400 phase 1 trials. So any of the impact which has been made in the medical science or medical field has been with the help of these researchers or clinical trials. In India, clinical trial per se is more safe because we don't do much of phase 0 and phase 1 trials. Our majority of the trials are phase 3 or phase 4. So already it's an approved drug with a non-side effect and other things. So you are getting the best treatment which is available in the Western countries, in India also. So I think so. Clinical trials need not be worried. You have to read, forelook everything and ask your doubt to your doctor. Clear all the doubts. And you should you should not be reluctant to participate in a clinical trial because it's not an experiment which is done to you, at least in a proper apex institutes where the clinical trials are happening. Thank you.